Coming up on this week's Best Docs Network, we'll feature allergist Dr. Lynn Dickens, plastic surgeon Dr. Michael Eisemann, podiatrist Dr. Gabriel Maislos, radiologist Dr. Stephen Rose.
It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Good morning, everyone. I'm Candace Kruger along with Jim Knox, and we're back once again with another edition of the Best Docs Network, featuring some of the best physicians in the Houston area that are helping to change people's lives.
Exactly right. And you know, Candace, a lot of people in the Houston area suffer for allergies.
They sure do, and you can add me to that list.
All right, we'll add you to the list, but we'll also add you to the list for a doctor that helps allergy sufferers. That is Dr. Lynn Dickens.
We finished the barbecue and I was cleaning the barbecue on the backyard. My wife and my son were inside the house. By accident, I guess I hit with my arm a very big leaf from a plant that we have in the backyard. And I didn't notice that there was a wasp nest on the other side of this big leaf. And then 3 wasps came from the other side and came right on me. And I remember having seen 2 wasps coming right like airplanes into my face, and I was looking at them, but then there was another one that hit me on my left arm, and that was it. I mean, within 10 minutes, basically I was all swollen up.
His biggest mistake when he was taken to the emergency room was that he stood up. If you're allergic to the bee or the wasp or the hornet, it will cause a release of histamine into the system and other things that cause you to break out, swell up, and lose your blood pressure. And it's the losing of the blood pressure that's the most life-threatening.
My wife tells me that I was totally like no strength in the muscles. Everything was like drooping. That's what she says. Everything. I just lost complete control of everything, of every motion.
Typically, we'll keep people on the allergy shots for a minimum of 5 years, and then we'll reevaluate where they are in terms of the usual blood test is what we follow.
The most important thing to me was that she explained to me, she made me understand what's happening. And I think that all the knowledge, all the understanding of what happened to me, and that this thing can be improved, basically, in terms of my case, you know, with therapy.
It's possible for a person, even if they're on the allergy shots, to have a reaction, so we don't want them to get too sure. And until you're really built up to your maximum dose and you're coming once a month, we don't really know what's going to happen. Hopefully you're not getting stung, but we always want them to be prepared for if there's multiple stings or if by some chance it didn't work as well.
You know, I like to understand things, and I think that having the knowledge of what happened and the treatment, and there is a process, definitely has given me and my family a tremendous peace of mind.
After undergoing a mastectomy, Colleen turned to Dr. Evan Feldman to help change her life. To find out more about Colleen's story and other life-changing stories, log on to bestdocsnetwork.com.
Our case example is Barbara, who was in her late 60s, who we operated on several months ago, and she was interested in removing some extra eyelid skin in her lower eyelid.
I've always wanted to have my eyes done, and he laid it all out. He explained to me what he was going to do.
Consider the eyelid and the forehead as one aesthetic unit. The cheek, the neck, and the jowl area we consider as another aesthetic unit. We do combine the surgeries, however there are people who are just interested in having their face done or their eyelid done, but sometimes if you just do the eyelid and not the brow, they still have that hooded appearance.
He put me at ease, and I knew that he was going to do a good job. And he did.
She really wasn't too interested in actually in her upper eyelid being done, and was mainly so concerned about her lower lid, but we showed her some pictures before and after of people who had it done, and after seeing that, she agreed to have her upper eyelids done, and I was happy she decided to do that.
And after about 4 weeks, all the bruising was gone, most of the swelling was gone, and I was shocked at how great I looked. I really was. I hadn't expected the change to be so great, and I'm just really overwhelmed at how different I look.
It doesn't look like she's had surgery, which is what we're basically trying to achieve, is a natural look, nothing stylized. But she can recognize it, and that's the most important thing.
And I met a lady in the bathroom who works down the hall, and she said, "You look great. What did you do? What's different about you?" And I started laughing, and I said, "Oh, I got a new hairdo." I mean, I didn't tell her, but it's amazing, and it's happened 3 times. And he put me so at ease. That's really what helped me make my decision that I was going to go ahead and do my eyes. Well, this has really made me feel better about myself. And so I really am so glad I did it.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
Many people suffer from snoring, but our next physician can certainly help. It's Dr. C.T. Nguyen.
What is snoring? Snoring is noise that is created by the airway going through your nasal passage and oral passage. If there is obstruction, then the air is turbulent and create noise when it goes through those passage.
Yeah, I came and see the doctor because I was a lot snoring. My wife, they have a lot of problems, you know. We can't sleep and a lot of snoring. I feel tired in the morning when I wake up, you know.
So when we examined Mr. Gonzalez, we found that he has a very obstructed oral passage. So his tonsils are enlarged, and he also has an elongated soft palate. We also looked at his nose, and we found that he has a crooked septum combined with enlarged turbinate, which also contribute to narrowing of the nasal passage, which also contribute to his snoring.
After the surgery, the first day, I took all the medicine and all that, and on the first week I lost some weight because they put me like on diet, you know, and only ice cream and liquid and all that, and I lost some weight, like a 10 or 12 pounds. It's good for me, for my health also.
After surgery, he's a changed man. He's a completely different man. He's lost weight because he's able to exercise. He's able to breathe better. He's able to sleep better. He's also rekindle with his wife, which you know, he can be more intimate with his wife, and you know, and they can share more time together, which is very important.
Oh, it's good, very good, because my wife very happy, and it's one of the main things. She say I'm not snoring no more. Yes, normal, and and also my health. I feel better than before.
What vaccines are important? Well, you should get vaccinated for the flu every year. The flu shot is very important, and you can't get the flu from it. A few people feel a little ill for a day or so, but that's not the flu. It's important to get the flu shot every year. The pneumonia shot is important to get if you have diabetes, asthma, or if you're over age 60, and also if you have kidney or liver disease. Young people in their teen years should have the meningitis vaccine twice, 5 years apart. Now the tetanus shot is a problem. A lot of people have the DT, that's a small D and a big T. That protects you against tetanus. However, everyone needs at least one Tdap. That's big T, little d, little a, big P. That protects you against 3 diseases. It protects you against tetanus and pertussis, which is the whooping cough, as well as diphtheria, which is a throat infection. You just need one of those, and then you can go back to the little d, big D every 10 years. So get your shots up to date. They don't hurt that bad. We're big people now. We can take shots without crying.
When I used to bite, I felt my teeth not grinding properly, and it was painful in my upper, especially my upper part. It was painful, and I don't think that was normal.
Reynaldo came to me, and he was missing some teeth on both sides in the lower jaw, and he had, I would say, compromised dentition in the upper jaw, and which was fairly non-functional and not very aesthetic.
I did not eat things that I like. I could not, because I felt that if you eat anything that is hard and I bite hard, it was breaking it.
Sometimes it takes a little sight, we call it sight development, and so we did 2 lower implants on the right and left in Reynaldo, and that was reconstructed, and then he decided he wanted to do something with the maxillary, we call it, or the upper jaw.
I felt a humongous difference on taste and how I approach food. I no longer looked at food and thought, I would like to eat it, but I'm better not. That was not anymore what I was feeling. I see if I feel like to eat it, I take the bite and eat it.
Oftentimes implants can be placed and restored immediately, and on his particular case, which is a large upper case, we were able to accomplish that for him.
It is being a totally improvement from my daily work to my daily eating. And I can see from a long future to come that I will have my smile and I will be confident talking to people, because no one can tell me that what I have is not mine.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Many presented in my office complaining of a painful bunion deformity. A bunion deformity is that deviation of the great toe, where you see that bump on the side or bump on the top. It has to do with a deviation of the first metatarsal, and basically, it just became really painful for her to walk in her regular shoes.
Yes, because I really had this bunion, I think probably about a year. And so it had got so bad I couldn't even wear a shoe, so that's what really made me came in, to have surgery on it.
The next step was for us to take an x-ray and to evaluate her foot and determine what kind of surgery would be appropriate. So after looking at an intermetatarsal angle, we basically decided that an Austin bunionectomy would be the best procedure. And so that's what we ended up doing.
After I had the surgery, I felt much better, no pain, it just felt better. And I was so happy, to get it done.
I mean, as long as you address the underlying etiology, the cause of it, then you're not going to get a recurrence, and it's wonderful. I mean, people suffer from painful bunions all the time. It can be painful to the point that you can actually develop an ulcer at the side bump, because first it gets red, and next thing you know, you have a wound. And that can be problematic, because then you can get an infection to the bone. I
mean, it's not sore or nothing. It just feels better. And so he really do a good job, and he makes me feel comfortable. I mean, he's a real good doctor.
Bunion surgery has a bad knock to it. A lot of people are concerned that They've heard from their neighbor, or they know someone at work who's had the surgery and it's extremely painful. I have some patients that have zero pain from the bunion surgery, but I can keep the area numb for 3 days with a pain pump, which is a device that just gives continuous drip of local anesthetic and keeps it nice and numb. Because really, inflammation is the first part of wound healing, and that's in the first 72 hours, so the first 3 days. It's a great relief for patients. Really 2 weeks of just not putting weight on it, and we've really come a long way with our surgeries.
Don't forget, for more information on any of the outstanding doctors you see on today's program, it's not just a television show, you can head to the website. It's bestdocsnetwork.com.
That's right, and our next best doc is plastic surgeon Dr. Evan Feldman.
October of 2011, I was diagnosed with stage 1 breast cancer and was advised that I needed a lumpectomy with internal radiation. Maybe a gut feeling kind of told me that I needed a second opinion. After looking at all my history, she actually recommended a bilateral mastectomy with reconstruction. So that's what I did on April 3rd of this year.
Breast reconstruction is a very rewarding surgery that we do for the patients. It's women who are going through, some of the most difficult times in their life. They've been given a diagnosis of cancer and been informed that they may lose one or both of their breasts.
I came and talked to Dr. Feldman about the whole process, and of course I was nervous, and I know I even started crying at one point, but he was so supportive and just assured me so many times I would be in good hands and I would love the results. And
so she chose to have an expander, an implant-based reconstruction, and that allows her to have a reconstruction that doesn't have a second surgical site. So rather than having to use muscle from her back or from her abdomen and impacting her golf game or her yoga or her active lifestyle, we're able to use implant-based reconstruction, which is a very nice result with really nice technology that's available to us now.
Just fabulous, yes. And he did a great job, and I had total confidence in him. And I've been feeling actually pretty good. I'm kind of wanting to get out and play golf, which I haven't been able to yet, but actually I feel really good.
Every patient has individual concerns, and whether it's lifestyle, whether it's recovery, whether it's, can they get back to their job or take care of their kids, that's something that we take into consideration with every patient. The surgery's gone so well and she's so confident with her results that she wants to be out and move on with her life and put the cancer behind her, and we've really been able to deliver her a nice result that she's able to do that with.
So many exciting things have happened since then. Not only the good prognosis with the surgery, but we're engaged now. Hopefully my daughter will be graduating from college soon, and I'll be able to retire early next year and kind of just move on with my life in a positive direction.
Keith had severe sinus problems until he met Dr. James Ludwig. To find out more about Keith's story and other life-changing stories, log on to bestdocsnetwork.com.
Charlie's weight was 380 pounds with a body mass index of 58. So, I mean, he's clearly in the high-risk group. In fact, anyone with a body mass index over 50 is considered super obese and has an even higher risk than our average patient would have for developing problems.
My wife and I did a lot of research when I decided to have weight loss surgery. And I chose the sleeve mostly. Lifestyle reasons.
Really what the operation's based on is changing the stomach into a narrower tube like the esophagus or the small bowel.
The recovery for my surgery, Dr. Marvin tells his patients up to 3 weeks to return to work. So I took the full 3 weeks off. I had the time to take. I probably could return to work after 5-7 days.
In modern society, we just don't need a stomach that we've been provided with. Whether it was evolutionarily necessary to be able to store a lot of material at one time because humans or pre-humans were not eating very often, but with the way our society is now, we simply don't need that much stomach. For some people, that becomes the pitfall. The capacity's there, and it generates the extra hunger that's just not necessary anymore.
It is a complete lifestyle change. The day I came for my very first weigh-in, I weighed 429 pounds. Today I weigh 265.
These operations provide the best chance of curing diabetes there is. People with diabetes generally go and see an endocrinologist who will try to control the blood sugar with medications, but that doesn't make the disease go away. Having a gastric sleeve, or particularly a gastric bypass, the cure rates are high. A gastric bypass, the cure rates for diabetes are probably 80%, 85%, maybe higher than that.
For the sleeve surgery, they say the average patient can expect between 45 and 83% of their excess body weight to disappear, go away forever. I had surgery, day after tomorrow will be 6 months ago, and I've already lost 63.6% of my excess body weight. I sleep much better, I feel much better, you know, I mean, everything's just so much better.
One of the best plastic surgeons in the Houston area, Dr. Lucian Rivela, helped one lady refresh her look. Here's more.
Here at Rivela Plastic Surgery, we perform plastic and reconstructive surgery. We emphasize aesthetic procedures, primarily of the breast, body, and face.
I was predisposed to like a droopy jawline, and so that began to be my focus when I looked at myself in the mirror.
Cheryl came to me with the concerns about her, again, the jowling area and deep lines on her face. She's a yoga instructor, and in particular the Bikram type of yoga where it's very hot, and I think she perspires a lot and is very thin, and she noticed her skin sagging. So to help her with that, we did what we call a mini facelift.
I talked to the staff first and then had a consultation with Dr. Rivela, and he recommended doing a mini lift. I felt like I was ready to do that, and you know, just with some guidance and the questions that I asked and the way they were answered, I felt like it was a comfortable procedure for me to move forward with.
In general, most of the patients are women that come for a facelift. They're in their early to mid-50s. They have the signs of some jowls and what we call marionette lines. Those are lines that go down on each corner of the mouth. They have some wrinkled skin on their neck, and so that would be probably the ideal patient.
I'm only 3 weeks out of my surgery. I feel like, you know, I'm really happy with the results.
Well, it's a good feeling to know that she now feels more confident, and she's of course smiling and very happy with the results, so of course I feel good about it.
I feel like that with the advice and the treatment and the service that I get at Rivela Plastic Surgery, I'm able to really maintain a level of confidence that allows me to get in front of people, and you know, most of the time with no makeup on, and I feel really good about myself.
Tiku broke his jaw growing up and his teeth never lined up until he met oral surgeon Dr. Paul Metz. To find out more about Tiku's story and other life-changing stories, log on to bestdocsnetwork.com.
Probably for the better part of 10 years, when I would cough or sneeze, I would release urine.
The leaky bladder is extremely common, and I think one of the biggest issues is that women just don't like to talk about it. They think they have to put up with it, or they're somewhat reluctant to talk about it in the office to their doctor.
It finally got to the point where it was interfering with stuff. I had to carry extra underwear and clothes to work, or I'd have to go home in the middle of the day, and it was I don't think anyone ever noticed, but I felt embarrassed and uncomfortable, and that was what finally made me decide to get tested to see if my problem was due to the incontinence that this would fix.
The procedure now is also a minimally invasive procedure, and it involves placing a small piece of mesh underneath the urethra. That's the tube that goes from the bladder to the outside, and it forms just a hammock or sling underneath the urethra, and when placed correctly, it has an over 90% chance of success.
After I had it done, I told Dr. Leibman I wish I had done this 5 years ago, because it made that much of a difference. But I thought I was too young, and so I convinced myself, oh, you don't have this, it's something else. This isn't going to fix your problem, and so I just didn't ever talk to him about it. So I should have talked to him sooner.
The recovery is also just wonderful. It's done as an outpatient. This procedure is still done as an outpatient in a outpatient facility or freestanding outpatient clinic. And the patient will go home, again, have something to eat, maybe take some pain medicine, but very little discomfort associated with it.
I sneezed, nothing, not a single drop. And it's been 2 years now. I mean, it's completely changed my life.
Very little discomfort associated with it. And what's really nice about it is that it's effective immediately. If it's going to work, she'll tell you the next day she hasn't leaked, much to her surprise.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Many of us live with pain, but you don't have to. PAMA's here to help. Whether it's sports injuries, arthritis, or joint pain, the physicians of PAMA are dedicated to your wellness and getting you back to pain-free days. So what are you waiting for? Go to PAMAinc.net and find a physician or orthopedic specialist who can help you stop pain and live life to its fullest again. PAMA, pain freedom. Go to PAMAinc.net.
I saw the potential in 3D, really taking digital to where we needed it to be, and it really has become what I would call a revolution. And I was very strong in my recommendations to the company that we really focus on looking at this as a screening tool. That's where it was going to make its impact.
2 years ago, I went for my annual mammogram and was in there, and they told me that they were doing a study for the 3D, and they asked me if I'd like to participate, and I said sure. I was already back there and undressed, and it was not a big deal.
She was the second patient in the multi-center trial that we did in 2010, and you had to come and get your standard 2D digital mammogram, which got read separately, interpreted by a different radiologist, and then the 3D exam would be performed separately.
First, I got the letter that said that no problem, didn't see anything, come back next year. Then I got the phone call and they said, well, no, we saw something in the 3D. And it turned out that one of the tumors was actually an aggressive, had a HER2 marker in it, which is can be one of the more aggressive cancers.
As we're able to page through the breast a millimeter at a time, we're able to look at areas that we would struggle with before on the 2D mammogram and say, is that something or not something? If you find malignancies less than 10 millimeters in size, the prognosis for the patient is essentially the same as the general population. So most of those people, the vast majority of those people, 98%, are cured.
Obviously somebody up there was looking out for me. I mean, I think it's the greatest thing. I mean, I think it saved my life.
So this woman had received a normal letter for her regular digital mammogram, but on 3D, we were able to find 2 very tiny cancers. That's the value of finding it at this stage, and that's what makes this test the most exciting thing I've seen in my professional career.
Well, that'll do it, everyone. That'll wrap up another edition of the Best Docs Network, featuring some of the most amazing physicians in the Houston area that are helping to change people's lives.
That's right, Candace, and let's remind everyone out there, for more information on any of the great doctors you see on today's program, head to the website, bestdocsnetwork.com.
And as always, if you have a question or comment, or if there's a doctor that's helped to change your life, we'd sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We'll see you next week.